My goal is to teach you to see the invisible so you can do the impossible. CBCT imaging has many layers. And when you look at cases like this, where you can clearly see large pathology, seems like an easy interpretation case, but it isn't. There are many layers and many findings associated with this scan. And I would like to point out that there's a lot of information here that can allow you not only to treat this large pathology, but also come up with a more comprehensive treatment plan for this patient. Let me show you some of the findings that this scan has. Check out tooth number 1. We're going to see that this patient has some periodontal disease, and we have here an enamel pearl in the mesiopalatal aspect. So chances are that you'll be so focused on that large pathology here associated with the anterior maxilla that you probably would miss this particular finding. It can lead to periodontal disease in that area. Secondly, when we actually observe the cervical areas of the molars and the premolars on actually both sides of the skin, you will see this triangular shaped cervical lesions associated with those posterior teeth. This finding is consistent with abfraction. So abfraction is a type of non-carious cervical lesion. They are relatively common, but they can adversely affect the structural integrity of the tooth, especially when it comes to the rotation of dental plaque, tooth sensitivity, pulpal vitality, and aesthetics. Now, another interesting finding about this case has to do with the mandible. That's partially visualized here. When we actually look at the mandible, you will see that there are several teeth with large carious lesions, like the first molar and the second molar on the right. So one of the questions that I get all the time is, Bruno, can I see caries on cone beam CT imaging? And the answer is simple, absolutely. Here it is, occlusal caries associated with that tooth. So as we continue to navigate the case, it's important to evaluate all the structures on the scan. On the left-hand side of the patient, you will see that the second premolar was extracted. And this extraction occurred about 2 months ago. So this area is in a healing process. But what is interesting about this case, it's what you actually see here with the posterolateral wall of the sinus, which is the posterior superalveolar artery. And in this case, the artery is very enlarged and is directly in the area where the tooth was extracted. You can see here that the second molar was extracted, and in the area of in the extraction socket, as we continue to evaluate this volume, let's take a look at the left posterior maxilla. There, you will see that the posterior superalveolar artery, it's actually enlarged and has an intimate relationship with the extraction socket that happened in the area of the second molar. Imagine that you're planning an implant for this area and you don't know that at the floor of the sinus there is a very large artery running through the area and actually through the apex of the first molar. Here on the 3D, we can evaluate the path of the posterior superalveolar artery. Now it's time to appreciate what's happening with the anterior dentition associated with that big lesion in the anterior maxilla. You will notice that there is expansion and perforation of the palatal and buccal cortical plates, and there is extensive external root resorption associated with the central incisor. As we continue to evaluate the dentition, please note that there is also internal resorption with the lateral incisor. And here on the 3D rendering, we can see this olive shaped low density area within the apical aspect of the lateral incisor. As we continue our evaluation, let's take a look at the canine. The canine will show extensive external root resorption associated with the palatal aspect. And the premolar will also show extensive root resorption associated with the apical aspect. As you can see, there are many more findings associated with the scan than just a large lesion associated with the maxilla. Stay tuned for more videos from the Cone Bean Guy. Don't forget to like the page and keep following me on social media. Keep scanning, my friends.